Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Let's take a look at some of the events that have trailed the health sector in Nigeria in recent times. The National Assembly is currently working on a legislation which, when passed, will prevent medical and dental professionals from gaining their full medical license until after 5 years compulsory service in the Nigerian medical system or health sector. This has generated mixed reactions across the board. While this happened, other significant events such as the World Health Organization's 75th anniversary and the World Health Workers Week, the World Health Day commemoration took place during the same period. Interestingly, the WHO, through its country representative Dr. Walter Kazadi Malumbo, called on Nigeria to add health to her exclusive budget list in order to guarantee adherence and to meet up with the 2001 15% funding pledge made in the Abuja Declaration. Malumbo reiterated that WHO is looking forward to a world where health will be seen as an enabler, socio-economic development and not a consumption goods. A world where health issues will be treated as human rights.
When we see someone coming, we should already think of intervention in the community that could prevent the same condition reaching others. That's the concept WHO is trying to drive. So multi-sector policy and action, community empowerment so that they can make the choice, and in equity, we are also missing that own community participation to contribute to their own welfare and well-being.
The United Kingdom has placed Nigeria on the red list of countries that should not be actively targeted for recruitment by health and social care employers. This is coming 1 month after the World Health Organization listed 55 countries, including Nigeria, facing the most pressing health workforce challenges related to universal health coverage. The United Kingdom government said Nigeria and other countries on the red list should not be actively targeted for recruitment by health and social care employers unless there was a government-to-government agreement. In the same vein, the Minister of Health, Osage Hanire, urged state governments to invest in health workers in order to reduce or avoid the menace of brain drain in the health sector and to prevent mass exodus. He also spoke about advancement in the health sector, among other issues raised during a press briefing to commemorate the World Health Day and World Health Workers Week.
Unfortunately, Nigeria is among 55 countries in the WHO on the WHO Health Worker Support and Safeguard list with shortage of health workers. This calls for support for health workforce development and health system strengthening. I want to use the opportunity to call on states in Nigeria to remove embargo on employment of health workers, including young doctors for primary healthcare centers and community health workers, and also to invest in generally increasing human resource for health in their states. Otherwise, there is a barrier to our vision of achieving universal health coverage and improving the quality of care. I also call on all stakeholders to ensure that more frontline workers are recruited so that we can ensure substantial reduction in shortage of health workers at this level. Personnel budget and health facilities also need to be maintained and also in better shape for frontline health workers. To continuously generate and maintain comprehensive data on Nigerian health workforce, the Ministry of Health has established a National Health Workforce Registry, which is a web-based information system that links health workers to their respective health facilities. The registry will seamlessly help to disaggregate healthcare worker information according to cadre, gender, location, age, specialty, etc. I'm pleased to inform that the Ministry of Health has already established the registries in 25 states of the Federation, including the FCT, with support from partners, and the data is being uploaded as we speak. Information from the registry, such as in some states, has been used to produce a state health workforce profile and also a bulletin for that state. The Federal Ministry of Health has an evidence-based and gender-responsive human resource policy and strategic plan to guide investment in health workforce. We are responding to issues of health worker migration by putting in place policy measures that ensure more health workers are trained, recruited, retained, and better remunerated. The ministry is also taking steps to elevate the Human Resource Health branch to a program to be dealt with by emerging human resource for health issues in Nigeria.
We'll take a quick break now, and when we return, we'll start the conversation around these events properly. Stay with us. Welcome back. If you're just joining in, this is the program Healthy Living on Trust Television, where we've been taking a look at some of the events trailing the health sector in Nigeria. A bill for an act to amend the Medical and Dental Practitioners Act, CAP M379, laws of the Federation of Nigeria 2004, to mandate any Nigerian-trained medical or dental practitioner to practice in Nigeria for a minimum of 5 years before being granted a full license by the Council in order to make quality health services available to Nigeria and for related health matters, HB 2130, passed second reading at the House of Representatives on April 6, 2023. Aimed at curtailing Nigerian-trained medical and dental practitioners' exit to foreign countries, the sponsor of the bill, Ganiyu Abiodun Johnson, argued that it is fair for medical practitioners who had benefited from taxpayer subsidies to undergo mandatory service for a minimum number of years in Nigeria before taking their skills abroad. The Minister of Health, Dr. Osagi Ehanire, agrees, saying, because if the government allows you to get training for about 1/10 or 1/20th of the cost of the private university, then it means it is subsidized. The bill is expected to be passed into law before the closure of the 9th Assembly in June 2023.
What really prompted this, there was a motion that I raised on medical brain drain. And in that motion, I prayed for certain things, that our public health care should be upgraded to general hospital. Our general hospital should be upgraded to specialist hospital and research centers. Also, I prayed in that motion that welfare packages of our medical practitioners should be improved on through financial institutions and private sector and government. They should collaborate with government. I waited for a while. Nothing happened. It was the reverse. I noticed that there is heavy decline on medical brain drain. From 24,000 to now, as I speak, we have less than 10,000 doctors in Nigeria. So that is alarming. So I now thought to myself that, okay, let us look at our laws, what is happening. I noticed that, look, the vacuum is that immediately after housemanship, you know, we notice that most doctors, because of greener pastures, there is a capital flight from Nigeria abroad to UK, America, and all that. Unlike their counterparts abroad, in US, it's an average of $82,000 to $100. That translates to over 60 million in naira. Ditto, that's at the exchange rate of 750 naira per dollar. Ditto in UK. So if you realize, if they can now take advantage of our situation, okay, and now open their doors, because just recently in 2020 UK opened healthcare and visa to people. They were all going to UK and US too, and Canada. So what should we do? Should we fold our arms? So now I now said, okay, maybe to give back to the society, that is to our people, after training you. Yes, we are not saying you cannot go abroad to make your money, but if government has subsidized your tuition, okay, I mean to the tune of 40 to 150,000, the least we can get from you is that after your housemanship, before you are given full license, before you are given full license, at least you can give back to the society within a period of 5 years.
Those in support, say aye. Oppose? Okay, Honorable Abonda. You see what I'm saying?
I have an eyes of seeing bills that will not move on well. Mr. Speaker, you're a lawyer, a constitutional lawyer. What this bill is asking is offensive to rights, occupational rights, and all whatnot. Let me take it again. The bill is asking that any Nigerian trained medical doctor must mandatorily train 5 years before he can be given license. After qualification, after license, you must work here 5 years compulsorily. That's not obtainable in any clime. Mr. Speaker, thanks to President Babangida, who then, before then, when you qualify as a lawyer, you do a tutelage, not even mandatorily. You do a tutelage in any chambers of your choice before you can start your own chambers. That law was seen as oppressive, retrogressive, anti-human rights, and was abolished. That the day you leave law school, you can start your chambers. Now, this bill is saying, very beautiful bill, he's trying to make sure we don't have brain flight and all waters and so on. Except you are giving them free scholarship to train. A parent may train the child in a medical school for 5 years, he qualifies. After 7 years, graduate, licensed to practice a medical doctor. Now the state wants to conscript that person to work for 5 years in Nigeria. For who? You didn't give them scholarship. You didn't provide for them. It is anti-right. That's what this bill is asking for. Why won't I oppose it? I have somebody now who is in medical school. So if you pass it when the government didn't contribute a couple, then they'll go and do forced labor for 5 years. Haba, it shouldn't go. It shouldn't be. So how can you pass it? I'm sure I want to draw attention to it. So if you see the purpose of it, it's slavery. In a modern time slavery. This is occupational slavery. How can the parliament allow occupational slavery to be? Once you pass it, it becomes a law, but it's a bad law. So I'm trying to say, it should be optional. If you now want medical doctors to stay, you can say, upon graduation, any medical doctor who wants to work in Nigeria will earn 1 million naira a month. Nobody will run. They will all stay. But when you don't have good pay for them, most of them, they will migrate to where they will. If I take a bank loan to train my daughter or my son to medical school, upon graduation licensing, he says you should come and stay here and receive 1,500 whatever a year.
Okay.
A month. It's not problem.
You've made your point.
Bill,
Honorable
colleagues, please let us start on this bill and rework it and come back. The way it is, it's not proper.
It will be a thing
of great interest to our society, because our population is over 200 million, and as I speak, the number of doctors we have is about 10,000. And if care is, we have crisis already. It's not if care, we have crisis. And how do we mitigate this crisis? Is by slowing down, carrying out a kind of stopgap. I call it stopgap. That let us increase the number of years they will get their final license. And the reason is that it's not that one is trying to restrict them. The 5 years I'm talking about is inclusive of the housemanship. It's inclusive of the NYSC. So technically we are talking about 3 years. And that 3 years is a way of promoting professionalism, because you can as well register for your residency in medical line after your NYSC. If you are engaged in hospitals, you can enroll for your residency. Your residency program takes an average of 5 to 6 years. So if with your residency, you are a specialist at the end of that program. So it's a way of encouraging, promoting our doctors to be specialists instead of just general medical practitioner. So if you will gain 3 years while you are here doing your residency, so by the time you complete that 3 years, you can as well complete your residency and leave. One is a win-win for the nation, it's a win-win for the medical doctors. Really, that is the purpose, that is the background of my motion.
Now let's talk numbers of the statistics of healthcare professionals available in the country, medical professionals that have left in the last year or two, and the ratio of doctor to patient at 4 doctors to every 10,000, which has fallen beyond global recommendation according to a data fight report in 2021, as opposed to the WHO standard of doctor-patient ratio at 1 to 600. A 2022 UK immigration report showed that 13,609 Nigerian health workers, including doctors, were granted working visas in 2021, making the country second only to the 42,966 from India. Other popular destinations for Nigeria-trained doctors include the US, Canada, Qatar, Saudi Arabia, and Australia. The statistics of Nigerian health workers ratio to the population show there are 15.64 nurses and midwives to 10,000 people, 3.95 medical doctors to 10,000 people, 0.20 dentists to 10,000 people, and 0.81 pharmacists to 10,000 people. These figures are worse in rural areas or areas facing security challenges. A 2023 Health Workforce Support and Safeguards List report released by the WHO showed that Nigeria and 36 other African countries face the most pressing health workforce challenges related to universal health coverage. Now back to healthcare legislation. Some experts speaking on the matter say the bill is dead on arrival and shouldn't be a matter up for debate at the Green Chambers. Baba Yusuf, who is a strategist and policy analyst, had this to say.
This bill, to my mind, is an evil bill. Why do I say so? Because it is not a bill that is offering solution, but a bill that is creating more issues. Not just for the medical practitioners in Nigeria, but the entire populace. The ratio of doctors and nurses to Nigerians is less than 1 to 100,000 as we speak today. And they are trying to bring a draconian law through a bill. to infringe even on the constitutional rights of citizens of Nigeria that decide to take on the practice of saving lives, and that is the medical practice. And ab initio, discourage citizens for those that want to study medicine to study medicine. And then subsequently, push those that have been trying as much as possible to support the healthcare system in Nigeria to leave anyway. And by the way, what is the logic or wisdom to put the cap on 5 years? We all know that 5 years is not even enough to nurture a medical practitioner, for example, a doctor, to actually become a specialist. So the bill actually will be dead on arrival with regard to its strategic objectives, if any, because those that we would like to retain, i.e. the specialists and specialist consultants, will not be impacted by the bill anyway. Those that will be impacted are the young generation of youth that are supposed to constitute the next line of the support group in the medical practice to start thinking and becoming creative of how to live Nigeria. I would have expected, even if you want to bring such a draconian law, to think it through. For example, because of the dilapidated nature of our educational system in Nigeria, you and I know that most of the students that study medicine are moving more towards going through the private university. How will this bill handcuff and shackle those that went through private institutions? Widows and mothers that fried akara and sold dudu, or sold palm oil or grains to support her daughter or her son to study medicine. Orphans that struggled and are supported by support groups, guardians and parents. Retirees, men that support their children to go and study this critical sector, knowledge to impact on society, and you handcuff them and chain them that they have to provide that service within a period of time. I want to see that clashes with the labor law, that does not allow such a thing to force you unless and until you sign off into an agreement, whereas it says so. And I thought that will only, even if it applies, should apply to those that went through the public school system. And even at that, the impact is negative. It is going to erode and further kill, rather than erode, kill our medical sector in Nigeria that is struggling without. I would rather see a bill that will embolden us to deliver better healthcare infrastructure, systems, better payment packages for the medical practitioners, training to upscale their skills and competencies and capacities for them to deliver, rather than being this draconian law when 90% of those people that are for this bill get medical support outside Nigeria anyway for themselves and their families. The issue of those that study in the private institution versus those that study in the public institution, that is just by the way. That is in fact one of the micro issues that why I said, is dead on arrival. I don't think it is going to be applicable. I don't think it will even pass through. Even if it does, I don't see it being actioned to the latter to deliver that objective. Because you see, what is the spirit behind that? It's not a matter of the number of years. The concept of the bill ab initio is based on short-sightedness and lack of multidimensional, consideration of the Nigerian situation, and total disregard, or rather lack of it, of the situation of Nigerians and the youth of Nigeria importantly. Because I would rather see a bill that will rather, like I said, ensure the upscaling of quality healthcare infrastructure amongst other critical infrastructure. Okay, healthcare system, capacities and competencies enablement for these healthcare practitioners, and incentives to encourage them to continue to provide service in a situation that is very dire, and to also bring regulations that will punish those amongst them that are erring in the practice, because we have a lot of bad eggs in the healthcare system, doctors and nurses, pharmacists and whatnot within the healthcare sector. So I expect parliamentarians to be creative and to be innovative and to be germane and reasonable with regards to the issue they should be bringing to the floor of our hallowed chambers. To my mind, this bill should not be a bill that a father or a husband or uncle or indeed a representative of people should bring to the floor of the House while we have these multidimensional issues. And in any way, how do you shackle people from traveling out of the country because they studied medicine in Nigeria? How will that impact positively in the progress of the Nigerian healthcare sector?
We also have some medical professionals who explored the factors influencing poor healthcare service delivery, the role of all stakeholders to ensure Nigeria achieves the goal of universal health coverage.
Apart from just having human resource, the distribution of the availability is a challenge. The quantity is a challenge. The quality in terms of training and the high turnover is a challenge. And then the distribution. So you have a skewed distribution where certain regions in the Federal Republic of Nigeria have more medical staffing than other regions. This is also a major challenge in the healthcare system, and this is reflected in the health indices, maternal mortality, infant mortality, which are higher in certain regions and can easily be correlated to the lack of human resource for health in those regions. In addressing every problem, we must approach it through, you can approach it through different strategies, but one of the simplest way to approach this is what you call the root cause analysis. And the question is, why are these health workers immigrating? One key factor is the lack of opportunities, the issue of jobs. So it will interest you to know that we do not have enough healthcare spaces advertised for the number of healthcare workers. So you see people who would graduate and would want to work, and the jobs are just not there, and to a large extent they end up in private sector, which is not as well paying as government. And even when you try to get a job, you may need to know have some level of external influence for you to secure those jobs. So one is opportunity to work. Is not even there. The second thing is opportunity for training. We basically do not have enough training opportunities for specialization in this country, and the specialist is someone who has done additional training and can contribute significantly a little more than the usual person who has done the basic training. So that is important to remember. So a lot of the doctors who are immigrating to start residency program and specialization abroad, because these specialization programs, some of them are not available. Even when they are available, the quality and the height to which you may be trained may not be as high as what is obtainable there. And if you really want the best, you may want to immigrate. So, and at the end of the day, it's about getting the best out of the situation for yourself and hopefully in future for your country.
That's the much we can take on the program today. For comments, contributions, and suggestions on these episodes, subscribe and follow us across all of our social media platforms. Join us again for another episode of the program, Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for watching.